Medflow Dynamics, we believe the future of primary care starts with smarter systems. We've built a pioneering AI-driven automation platform designed specifically for general practice. Why? Because GPs are drowning in admin, and the current system just isn't built for the pressures of modern healthcare. What makes Medflow Dynamics truly unique is that it's been masterminded by GPs themselves. Clinicians who live the day-to-day challenges, who understand the pain points, and who know exactly where the bottlenecks are. They've reimagined how practices should run, with a vision to transform GP workflows, improve patient care, and make the workplace more efficient. Our technology automates repetitive tasks like managing pathology results, processing referrals, and handling documentation. We streamline patient flow, reduce admin overload, and give time back to the people who matter most, clinicians and patients. Medflow Dynamics doesn't just digitize the process, it revolutionizes it. We modernize practice management systems to boost productivity, ensure compliance, and future-proof healthcare delivery. Our platform is built to scale, integrate, and adapt to the evolving needs of primary care. And for investors, this is more than just software. It's a solution with real impact, tackling one of healthcare's biggest bottlenecks with powerful, intelligent automation. Medflow Dynamics is not just about efficiency, it's about empowering a healthier, more sustainable future for general practice. This is the future of primary care, and it's already here. Medflow Dynamics, bringing AI automation in healthcare.
Well, welcome to Inside Primary Care, a webinar series exploring and sharing stories from leaders in general practice in the UK. Today I'm speaking with Dr. Kunal Kothari, a GP partner at Bute House Medical Centre in Luton. Alongside his frontline GP work, Kunal is a GP trainer and training programme director, and soon to be Associate Dean for Bedfordshire. He has a strong interest in positive leadership. Dr. Kunal is also a co-founder of K2 Smart Life, a project focused on lifestyle medicine and metabolic health. This approach tells me that Dr. Kunal likes to address the root cause of societal changes, such as type 2 diabetes and health inequalities. In this conversation, we'll talk about his story in becoming a GP partner, an educator, and lifestyle influencer, and his take on the latest developments in GP practice. So, welcome, Dr. Kunal.
Hello, thank you very much for invitation, and thank you for Medflow for organizing this podcast, and thank you very much, and I'm glad to be here.
Great. So, Dr. Kunal, you've deliberately gone beyond the traditional clinical GP role and gone more into the management and leadership side of things and thinking at a system level. So, we'd like to know, what was the moment or experience that made you think, I need to understand how practices are run and not just see patients?
I think yes, it's kind of different, but it's all one spectrum in a way. And I have always believed in that you can't you can't say I'm a leader. Leadership is not something given. It's not a title. You become leader if there are followers and if the people kind of follow your vision. So you do your work and then you do that. So in a way, yeah, I mean, it's not a conscious choice that decided one moment that maybe I should concentrate on that. But what you learn over the time that yes, as a doctor, we all want that sort of one-to-one interaction with the patients, and that's most satisfying part for any clinician. If you ask that what is the best job of their time, is actually having that satisfaction, that thank you when you get from patient. Nothing beats that, and in general, people are very happy with their GPs, and you get a very positive feeling. But over the time you realize that actually, yes, while you can have an impact on a small number of patients, which I can see maximum in one day, but when you are looking into system level, when you are looking into various leadership positions, if you don't have a wider impact, and people who have worked and been through grassroots level, if they don't sort of give their input
Mm,
into leadership position, then actually you will end up having policies and procedures which are not tailored to what actually grassroots people need.
mm,
And I think that's where the gear shifted. So as a GP partner, and I think in previous episodes of this thing, Dr. Swain actually explained very well in terms of the what general practice in UK or NHS is. But when you look at that part of it, I always believe in that as a partner, your job is not to just run the practice, but your job is to lead the practice
mm.
and be there to give the direction.
Okay. And so so can you, that's very interesting, of course, because you say on the one hand, getting the thank you from the patient is really, really satisfying, but you also need to think beyond that because, yeah, real impact can be from more systems level. So can you think of maybe a concrete example in your from your own practice, how, maybe a change that you achieved that made a difference and that was way more than what could be achieved just one on one with one patient in a consultation room?
I think the lot of things actually. It's if I look at sort of practice level, and we are very lucky that I'm in this practice. I'm partner for almost 15 years, and we have a very stable team of partners, and we are pretty much, you can say, grown together into the role. So what happens is that you can easily come into, say, the treadmill situation where you keep on doing the same thing all the time and then expecting a different result. But anytime a new policy change comes, a new target to achieve certain things, etc., comes. So, like, say, in general practice, the total triage is a new thing, and the access requirement, and a lot of those sort of new rule came. But rather than just trying sort of, that okay, when it's inevitable that you need to do that, you do something about it, stepping back, looking at that sort of a senior leadership within the practice, you make those sort of changes to the rota, to the start time and finish time of the staff, etc. You do it in such a way that while certain policy change is beyond our control as a kind of a people running the practice or even a primary care network, etc., level, certain policy change come from much higher level, so you can't fight those changes. But your job as a local leader is then to make it in certain way that it still works and avoid burning out your administrative staff, your clinical staff, and you can tailor the system. And actually looking back at some of those examples which happen within the training system of the GP resident doctors, within this sort of total triage, etc., we feel that yes, there was a clear impact of those changes.
So maybe not all of our listeners or even me know exactly what is meant by total triage. So maybe could you maybe yeah, just go through one concrete example and how
So
it,
I think in a sort of a old sort of a general practice way, that patient used to be just kind of a contacting their GP surgery if they need an appointment, etc. And then pretty much most of the time, it at the reception level, they kind of give the appointment. And there is a little bit of local knowledge which receptionists, if they're long term there, they know the patients and they do that thing. Now, what we are having with that sort of a modernizing general practice part is that a patient instead put a request in. So they just go into the online portal, they write their symptoms, their duration of the problem, etc. They put it in the request, and then a clinician at the other end and our level, different practice do it differently. In our setup, the GPs are the one who actually look at those requests and then decide that is the patient best to be seen by a pharmacist instead of coming to general practice. Maybe just need a phone call, or maybe they need to come face to face, and even tying up to the doctors with the right skill where those patients you can put into. So that's the sort of a whole total triage system. So within that, obviously, you need to have the rota system in terms of what are the clinicians going to do that. You need to have a good combination of the same day appointment versus a kind of a chronic appointments and things like that. So, but that's the system, which is the total triage, which was one of the recent change in last 18 months or so.
and so like so when you were so you enjoyed being part, like discussing with your practice how to implement it in your practice and thinking strategically what's going to be deliver the best outcomes for your patients. And
Absolutely. So I think that sort of thing, yeah, when you get that sort of thrown into those changes, etc., sometimes you feel very overwhelmed because we try to control the situation or we try to control the policies or protocol which are beyond our level. But then I think you just have to break it down into small steps and look at it what is in our control, uh, and make that sort of small changes which actually are make you more effective, more efficient, more productive, uh, without burning out the people who are in the system or working.
mm, that sounds like a real rational approach, and I'm sure people who work with you appreciate that approach, that you consider what's good for their well-being and their ability to do their job. Um, you're also moving towards an associate dean role in Bedfordshire, as if I understand correctly. So, congratulations for that. What do you hope to change or influence from that position that you can't change as much from the practice level?
I think the difference at that level now is that a lot of people are. So I could be very good GP in terms of the how I manage my patients, how I manage my day. So I can discipline myself or give direction to myself. But when you are into that sort of a higher status, uh, the team you work with or surround with are also going to be very, very capable educators, doctors, leaders. And in a way, your job at that point is not about just being another extra pair of hand, whereas your job is to have that sort of understanding the people you are supposed to be in charge of, creating environment for them. And so that sort of any senior leadership position, whether it's education or management, uh, when you ask a lot of people in senior position, they will tell you the best part of their job is people, and the worst part of their job is also people.
Hmm.
We have a lot of drive to standardize things, so we prefer policies, protocols, programs, pathways, but actually you can't standardize people. So you have to tailor them, and in a way, a lot of work is going to be done by that sort of intelligent people around you, and your job is really to facilitate. So I think I believe in that is what we have done at practice level, and I'm hoping that we can put it in larger level. It's just the ABC of leadership skills, and A is for autonomy. That the people should have that confidence to be able to do what they want to do, and have feel that freedom they have. B is for belonging. So people feel safe enough. They feel part of the organization. They can connect to the direction of that organization. And C is for curiosity, where people don't mind trying innovation. They're not afraid to try something new and fail. And your job as a leader is to give that psychological safety that it's okay to try and fail rather than keep on being on the same treadmill.
Mm.
So I think that's sort of a, I would say, overarching way into that sort of any leadership position, really.
Mm. Really interesting. So yeah, you're very you have a clear, like, quite hands-on approach, it sounds like. So when I first heard about you, one of the first things I was told about you was that you trained your own practice manager, which is actually quite unusual among GPs. So why did you take that approach, and what impact do you think it had on the practice?
Well, it's not truly doing that, but I think it's more of a seeing that hands-on management. In the so olden time, we used to study that leader need to lead and managers need to manage, and actually the truth is somewhere in between. So as a leader, every leader needs that sort of a telescope and microscope. They say that your telescope is that north star, so you as a leader give the vision, give the direction, but then you can't drag people to that direction or the vision. You need that microscope in terms of what do you do day to day so you can reach that destination. And that's where you need to work with your operational team So that's your business manager, practice managers, deputy, various leads, various colleagues. In practice nowadays, there are different people in charge of different area, and what you need to do is to make sure that everybody is clear that what is that larger goal, and ultimately I feel that, so there is again the good thing what they say is that our job is to everybody job or everything have a pain point.
Mhm.
If you ask anybody, they will certain aspect of their job they don't like it, and then our job is to make that pain point into purpose. Once you can change that, give the right direction, and actually then that's where you can do innovation, creation, adapt things, etc.
Mm, indeed. And so, so I'm curious to know. So you talk about. I really like that analogy of telescopic, like vision, and then microscope, which is more operational. So then you can make the micro steps to be going towards the vision. But what was your vision for your practice, and how is it different from any other practice? Because for me, as a non-medical person, a GP practice is a GP practice. It's I go there, I see my GP. So, what vision did you like
I
to
I
put?
think I think the simple vision was that one is to make that sort of a happy place to work, because you cannot, as I was saying, the challenges will come, events will happen. You will not have control over those things, but your reaction to those events is in your control. And can you make a happy place? Because you cannot live life weekend to weekend and holiday to holiday.
Mm,
So really, as our senior leadership team within the practice, our single goal was that when people wake up on Monday morning, they should feel excited about going to work.
mm,
They feel that they will have some positive conversation, they will have some innovation, they will have freedom to act in certain way. So you don't need to micromanage people in that sense. And so I think, yeah, it's just creating that environment which empowers all your colleagues, all your kind of a trainees. So I think as a training practice, we have at a time 6 to 8 GP registrars or resident doctors they call now. And again, you have to give them that belief system that certain things, etc. There is a steep learning curve when you are trying to become a qualified GP, etc. So I think as a practice, it's just about creating that environment. And again, it's there's a lot of dashboards and there's a lot of comparison between various practices locally, nationally, etc. But actually, it's like life. You don't compare yourself to other people. You just want to be better version of yourself.
mm,
Whatever you were a year back, have you do you feel your progress into various marker?
mm,
And if you are a better version yourself, so you follow your own trajectory, and actually understanding early on that you are in your own league and you don't need to compare yourself, and there would be people doing things better than you which you go with open heart and learn, and there might be people who are not doing certain things as well as you, but even that's your learning opportunity.
mm.
So everything and anything, people who are better than you or people who are worse than you on paper, but you can learn from both of those categories.
Oh, brilliant. So, um, this is really music to my ears because, yeah, I come from a psychology background myself, and yeah, it's clear to me that you have a growth mindset, and that's really positive. I want to ask you, so you clearly are very reflective about yourself as an individual and then also your own practice. So, if you look across GP practices in the UK, what are one or two things you think many should be doing in terms of management or leadership, but most of them currently aren't?
I think that being open-minded, because a lot of people like that comfort zone. People don't want. People have a set way of doing it, and sometimes people would think, okay, I'm going to retire, maybe say in 2 years' time. Why would I want to change the way I work?
Mm,
And we have seen that all the time. It's like I remember when I was qualifying. So this is 2007 to 2009. The computers were just there for last 3 4 years at that time, and then there were a lot of things were changing online, like requesting blood test and doing various tasks using computer. The accounts were becoming that sort of a computerized, etc. And I saw at that time a lot of that sort of a generation of the doctors who were about to retire. They're very reluctant because they like their normal Excel sheet and they like the
Mm.
way they were working, etc. And they didn't want it to change. And I feel that previously I used to say that every 10 years you reach that situation where you need to step back, look at the situation and adapt yourself. But now with I feel that situation is coming every 5 years. That
Mm.
actually, even if you are qualified 5 years ago, you will be out of date with the innovation change, and plus the people who are just 5 years younger than you are like one generation younger than you. So that gap which used to be 20 years, now every 5 years you feel that it's a brand new generation.
Mm.
And if you want to stay relevant, if you want to learn, like this sort of thing we are now talking with, hopefully a lot of people with the medium of a podcast. Now that sort of thing wouldn't have been possible with you sitting at one place, not even within the UK, and me sitting somewhere else. But we can do that, and
Mm.
we have to open to that part of the technology, and that will be same for AI. It's about how. So I always, they say that will AI replace humans or doctors? No, AI probably won't replace the doctors, but AI will replace the by the doctors who use AI.
Mm.
So you have to be open to that part, learn the system, and so I think, yeah, my message to everybody is uh, be out of your comfort zone, because the true progress only happens once you are open minded to make some positive changes.
Indeed, indeed. And where do you see the biggest untapped opportunity for innovation in GP practice management right now?
A lot of those things, meaning, I think it's a, if you look at any practice manager, amount of things they have to have maybe on your head or somewhere in Excel sheet or something is too much. So general practice has moved from a small practice. If you look at old model, there was a one GP. Usually the wife would be the practice manager,
Mm.
or a husband would be a practice manager if wife is a GP. So that sort of setup, a small family practice with a few patients which everybody knows by their name and address and things like that, where you don't need that many policies and protocols. Now you will be, most of the practices are, even less than 12,000 list size practices are called small practice. So with that, there is an increasing requirement to have a complex system of what will be your recruitment process, like where your HR file will be, how you are doing communication with lots of people in the practice. Not everybody will be working every single day. So how do you do internal communication? How do you keep, so because if you because otherwise the danger is that, that Simon Sinek's book Start With Why, and he talks a very good thing about that. At say, as any leader, you have a big vision, so you have your vision, but then it comes down to your manager level, that vision get diluted. Then it gets down to reception level, that get diluted further. So the danger is that a lot of people, you might have a very big vision, but if a patient or a housekeeper in your practice doesn't have the same vision, then it doesn't work. And I think there was a good example there, that somebody asked the janitor working in NASA that what do you do, and he said, I help kind of send the rocket to the moon.
Mm.
And it is recognizing that part, that every single person is very important in the whole cog, and it's not just a leader can make any changes. And I think once you give that belief and empowerment to people, then system will flow. And so, yeah, that's why some degree of help which keep all this thing under organization, under the folders, under the right notification will be required.
Okay, so you think that, yeah, do you think AI, that's where the biggest untapped opportunity is? Some sort of AI kind of software that can deal with a lot of the organizational matters in a GP practice. Um, You think that's the biggest?
Yeah, every aspect of life, nowadays you cannot see anything, which would not be related to that. You are going to get more and more stuff which are related to AI. I think it's every aspect of our life now. Even if you look at any reviews of, like, say, some sort of Amazon or TripAdvisor reviews, now you get an AI summary of the feedback before you can actually read the reviews. And that sort of part is unavoidable. It's a part and parcel. And I think, yeah, we just have to look with the open mind that what are our areas specific to primary care and general practice,
Mm.
which we can adapt AI smoothly. But because it's a NHS, it's patient's data, it's a very confidentiality part, it's a GDPR regulation. So it's not as simple as losing AI for your personal work. Here you need to have right approval, right pathway, and all those things are important, because it's at the end of the day, patients very sensitive information which hold by GP surgeries.
Mm. But then, what would your warning be to GPs or practice managers who are either too skeptical about AI or too excited and unrealistic?
Somewhere, I think there is a whole theory of that sort of a change management, that you need to not worry too much about. A lot of people, time we try to convince the most skeptical person, because that in a room these are the people going to oppose you. But actually, your job is to find those like-minded people, early adapter, get into them to make those sort of right changes. Once you create the momentum, then the people who sit at the fence will change, and afterwards the skeptical will remain skeptical, and they will only join when there is no other option than not to change.
Mm. Okay, and so what's the most surprising thing you've learned about GP practices? Um, or sorry, what's the most surprising thing you've learned about how GP practices actually function compared to how people imagine they function?
Difficult to say, Ming, because for us, obviously, we are into the system in
Yeah.
that sense, and a lot of our friends and colleagues are also working in the same system. As you know, being in Luton, it's one of the very kind of deprived town in that sense. A lot of practices are deep end practices. So I think in that sense, yes, we all have our own interpretation, but that could be very narrow as well. So I'm kind of quite aware that what we see world is a kind of one way of looking at it, and that not necessarily could be the correct picture.
Mm.
So rather than strange or anything, all I would say is that if you are a leader, don't be afraid to take the decision. There is no right or wrong decision when you're a leader, but leadership is about confidence, about having that confidence to make that decision, and then standing by that decision and making your team to work around that decision to make it right. Uh, so yeah, you are not going to have every decision right, because none of us have a crystal ball, but
Mm.
we can always channel our energy, our team, to make those decisions right.
Yeah. So it's not just about what decision, but it's also about getting everyone on board and working together towards the vision of that decision.
Absolutely. I think that's the most important part of it, is about that sort of a direction. Because a lot of time we talk about we need memorandum of understanding, etc. But all what you need is a true understanding of the people, and it's back to that sort of people. And I think it's so. I always say that now in AI time, while so previously, if I want to say gain knowledge of, say, a different area, I maybe mingle with a lot of people, I could go on courses, I could kind of do some self study, and combination of that, and I would know about a topic. Now I could just lock myself in a room with some AI tools, etc. Within 2 3 hours I can get every knowledge and aspect of that topic which I had no idea. But that would also mean that human connection is more important, because otherwise you will get overwhelmed with the information. So you might have a lot of knowledge, but what are you going to do with that knowledge? So actually, on one side, yes, we are going towards AI era, but on the other side, the relationship building is most important than ever, actually, just because of that AI era. And that's what I really want to give the message to everybody, that it's ultimately end of the day is about creating that sort of a positive, good team, and that sort of a empathetic leadership.
Well, yeah, I find that to be a really reassuring and centering piece of advice because, yeah, in the age of AI, there's so much change that's going on, and some of us are questioning what value they can bring if AI is doing many of their tasks in the way that it is. So, but yeah, ultimately, yeah, technology exists for people. People don't exist for technology. So, um, togetherness and working together, cooperation, collaboration is, I think, is always going to be there, and it's AI should only strengthen that and not take it away. And so, if there's one piece of advice, because we do have to round off pretty soon, a half an hour went by pretty quickly. If there's one piece of advice that you could give to a GP partner or practice manager wants to start improving their practice but doesn't know where to begin, what would you say?
I think back to what I was saying is that there are understand the difference between the programs and protocol to be managed, but people to be understood, and having that sort of a relationship building is important part. And that's why the message is that if you look at the humans are kind of social animals, and we have always survived as a tribe. And what makes strangers to tribe? So if you're meeting the first time, you will tell me your strength and I will tell you my strength. But if we were to become a tribe, then I feel comfortable sharing my weakness to you,
Mm,
and you feel comfortable telling me your weakness. So that sort of thing where we can share with each other what we don't know or what our weakness are. So having that environment of psychological safety,
yeah,
if we can create that environment within each and every organization, medical or non-medical, the people will thrive. You will get the full potential of each and every individual,
mm.
because there's no one person who can change anything, but collectively we all can definitely make the momentum and change.
Okay, wow, that's a really powerful message, I find, because I think, yeah, I've probably in my own life experienced maybe some organizations that, they do well, but they don't foster this intimacy where you feel like you can be truly yourself and be honest about what your weaknesses is. Often you feel like you've got to show up and be the best and be amazing, otherwise you're out the door. But rather to really get the team and try to work together, you've got to create a sense of belonging and trust in each other, that you know that you can be more, yeah, transparent, and that way you can help each other if you know each other's weaknesses, and it's more like organizational intimacy in a way. So that's a very yeah, wholesome piece of advice. And yeah, I guess also in that sense, the leader doesn't need to have all of the answers, but if you create a team that trust each other, then you empower each individual to bring in their own ideas, and then the whole team is stronger.
So one thing I always tell people, and we were talking about comparison, etc., that grass is always greener on other side. We used to say that. Now I say actually grass is greener where you pour water.
Mhm.
So you invest in what you have,
Yeah.
the things will follow. You don't need to chase butterfly. You just make beautiful garden. Butterfly will come.
Mhm. That's a beautiful message to close on. So thank you very much, Dr. Kunal, for sharing your story, your perspectives on the future of GP practice, and also yeah, very wholesome piece of advice as well. So yeah, we appreciate that very much. If you are listening and you work in general practice, this is to the listeners. I'd love to hear from you in the comments. Yes, you in the comment, and who are listening at home. What's one thing in your practice, whether it's clinical, managerial, or cultural, that you'd most like to improve in the next 12 months? We would love to hear that. You can share as much details as you want. You can keep it high level if you don't want to share all your secrets. But yeah, so it'd be great to see that in the comments. I will be reading those as well. And that can help inspire the future episodes and guests as well, and topics. So we'll be sharing more stories and conversations just like the one today with Dr. Kunal, so on this webinar series, Inside Primary Care. So please stay connected, and thank you for joining us today.
Thank you very much, and it was pleasure to be here. And see you all.
Thanks very much.